You're listening to Hardline. My name's Dave Debo. Congressman Brian Higgins is here, and the phone lines are lighting up. I'm not even going to mention the number right now, because right now all the lines are full. So let's just go right to the phones. We start out with Connie in Depew. You're on the air. Go ahead.
Hi. First of all, I'd like to thank you for your support of health care reform with a strong public option. My question is this. My employer does offer health care coverage, but it's something I'm not happy with. Would I be able to choose coverage through the public option instead?
You will, and that's why it's called a public option. The option will be available to all Americans, and again, I think that option can be used as a basis from which the countervailing force, if you will, to the current private insurance industry that we have now. And it's all about choice and competition toward the goal of driving higher quality outcomes, clinical outcomes is a technical term, and containing costs, because while people may be happy with their health care now, their premiums are scheduled to double in the next 10 years, and fewer employees will be able to afford it, and employers will go bankrupt as well. So this is an opportunity. In America, we're the land of possibility, and I think this is a 60-year debate. I think the time is to move forward. The risk is in doing nothing, and I think people have to embrace change for economic reasons and also for healthcare reasons. We should have the best health care in the world at the lowest possible cost, and we don't have it right now, and that's a fact.
But there are people out there who don't want to embrace the change. Diane, I understand that you're on the line now. Your whole idea is that this is unnecessary, am I right?
No, actually, I do feel it's necessary, but I wanted Brian to address the
question on my board said why is it necessary?
Public plan option would not be considered socialized medicine, because we hear from the media if we go down that road, we're heading to socialized medicine. Could he please address that?
Well, the characterization of healthcare reform as socialized medicine is 60 years old. It's old, it's shrill, and it's not true. What you'll have is a not-for-profit public option that is supported by the premiums that are paid into it. And what we want to do is model that after the Cleveland Clinic, the Mayo Clinic, and those other high-quality, low-cost plans that are available right here in America. And everybody should have access to that health care.
You've used the word public option, so did one of the callers. Is that, and I don't want to even call it a tactic because that demeans it, but is that part of the debate here, to choose certain words because some are less value-laden than others?
Well, look, there's in fairness, both sides are guilty of sensationalizing this debate. They really are. I listen to the debate very carefully. I listen to opposing sides so that I can better understand where they're coming from. But the reality is we have a system that doesn't work. This isn't a mass federal governmental takeover of health care. What it is, it's the creation of another option that people can choose to go into or choose to keep what they have. And as I said, I think the Buffalo area does well. I think the healthcare providers, the Catholic health systems, Kaleida, ECMC, are high quality. They're collaborating. They're working together. I think Independent Health, I think Health Now, I think Univera, I think all the others provide good service. I'm concerned about places like McAllen, Texas, whose healthcare costs are double that of which we have in Western New York. The Miami, Florida, $16,000 per Medicare recipient. Yet in Buffalo, it's $7,000.
Rhetorical argument, though.
Sure.
If we're doing good here, and you're Congressman Brian Higgins representing here,
yep.
Devil's advocate, why worry about McAllen, Texas? Let them figure out something maybe that the state of Texas can run. Why is that not a valid argument?
Because even though you live here, you're paying for it. And this is a national problem. And, we have to begin to do... there was an estimate from the Congressional Budget Office that said we could save 30% or $800 billion a year on healthcare costs if the high-cost, low-quality areas adopted the low-cost, high-quality delivers of healthcare. Cleveland Clinic, Mayo Clinic, Johns Hopkins. And the information is indisputable with respect to the quality of care that's offered there. How many people do you know from Buffalo and Western New York that travel to Cleveland Clinic to get their health care?
Yeah, there are a few.
But in fairness, let me also say this. The Buffalo Niagara Medical Campus is embracing those principles. It's the integration of clinical work, of research, of academics. They not only share space, they have a shared vision and a shared purpose. And so I think the Western New York healthcare infrastructure and the human infrastructure ought to be applauded, because I think we're one of the areas that are doing it right. But we have to have that for the entire nation, because you and I are stuck with the cost if we don't.
803-0930, our break for news straight ahead, and on the other side, more with Congressman Brian Higgins. This is Dave Debo. You're listening to Hardline on News Radio 930, WBEN.